Listen to the following talk.
Quinolones are a class of synthetic broad-spectrum antibiotic drugs that are used to treat a variety of bacterial infections. They function by interfering with bacterial DNA replication, which ultimately leads to the death of the bacteria. Here are the detailed aspects of quinolones. One, chemical structure. Quinolones are characterized by a bicyclic core structure composed of a quinolone nucleus. The basic structure involves a quinolone moiety fused with a pyridine ring. Fluoroquinolones, a subgroup, have a fluorine atom attached at the 6th position, which significantly increases their antibacterial activity. 2. Mechanism of action. Quinolones target bacterial enzymes DNA gyrase, topoisomerase 2, and topoisomerase 4, DNA gyrase. This enzyme introduces negative supercoils into DNA, which is essential for DNA replication and transcription. Inhibition of DNA gyrase prevents the supercoiling process. Topoisomerase 4. This enzyme is crucial for the separation of interlinked daughter chromosomes. Quinolones inhibit this enzyme, preventing the proper segregation of bacterial chromosomes during cell division. 3. Spectrum of activity. Quinolones have a broad spectrum of antibacterial activity, effective against both gram-negative and gram-positive bacteria. Their spectrum includes gram-negative bacteria, such as Escherichia coli, Klebsiella pneumonia, Pseudomonas aeruginosa, and Neisseria gonorrhoeae. Gram-positive bacteria, including Staphylococcus aureus, including methicillin-resistant strains, Streptococcus pneumonia, and Enterococcus species. Number 4, generations of quinolones. Quinolones are classified into different generations based on their antibacterial spectrum and pharmacokinetics. First generation, limited activity, primarily against gram-negative bacteria. Example, nalidixic acid. Second generation, improved gram-negative activity and some gram-positive coverage. Example, ciprofloxacin, norfloxacin. Third generation, enhanced gram-positive coverage and better activity against atypical pathogens. Example, levofloxacin. Fourth generation, broad spectrum coverage including anaerobic bacteria. Example, moxifloxacin, gemafloxacin. H5, pharmacokinetics. Quinolones are generally well absorbed orally, with bioavailability often exceeding 70 to 90%. They distribute widely throughout the body, including into tissues and fluids such as the prostate, lungs, and bile. Most quinolones are excreted primarily via the kidneys, though some are also metabolized hepatically. Number 6, clinical uses. Quinolones are used to treat a variety of infections, including urinary tract infections, UTIs, respiratory tract infections, including pneumonia and bronchitis, gastrointestinal infections, e.g., traveler's diarrhea, skin and soft tissue infections, bone and joint infections, sexually transmitted infections, e.g., gonorrhea, certain types of meningitis and intra-abdominal infections. 7, side effects and safety concerns. While effective, quinolones can have significant side effects. Gastrointestinal, nausea, vomiting, diarrhea, central nervous system, headache, dizziness, insomnia, seizures, rare. Musculoskeletal, tendinitis and tendon rupture, particularly in older adults and those on corticosteroids. Cardiovascular, QT interval prolongation, which can lead to serious cardiac arrhythmias. Other, hypersensitivity reactions, phototoxicity. 8. Resistance mechanisms. Bacterial resistance to quinolones has been increasing and occurs through several mechanisms. Target site mutations, mutations in DNA gyrase or topoisomerase 4 that reduce drug binding. Efflux pumps. Increased expression of efflux pumps that expel the drug from the bacterial cell. Plasmid-mediated resistance. Acquisition of plasmids carrying genes that confer resistance. 9. Clinical considerations. Use with caution in patients with predisposing factors for tendinitis or QT prolongation. Avoid in pregnancy and children due to potential effects on cartilage development. Drug interactions. Avoid concomitant use with drugs that prolong the QT interval or interfere with renal excretion of quinolones. Hammer 10. Future developments. Research continues to develop new quinolones with improved efficacy, safety profiles, and activity against resistant strains. Novel derivatives and combination therapies are being explored to overcome resistance and extend the utility of this important class of antibiotics. Understanding quinolones' broad spectrum activity and pharmacological properties allows clinicians to effectively utilize them in treating diverse bacterial infections, though mindful of the potential adverse effects and emerging resistance. This is merely a sample of material for learning English.
What do you think of this video? Please provide your feedback below. Thank you for watching. This is a VTP channel. You can find us at youtube.com/@VTP.